Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we're in Cartago. You know what? Cartago has a special place for me because that's where my grandmother lives. But we're not going to talk about my grandmother. Today we're going to talk to the doctor. And for you women out there looking for a special treatment in a very special area, I'll let her talk because I'm not the one that's specialist with this. Doc, how you doing today?
I'm doing fine. Nice to meet you and have you here in Cartago.
Isn't Cartago beautiful?
It is all around. It's nature.
It's
people.
Is it a little cold here?
It's freshness.
But it's a little cold, right?
No, not anymore.
Yeah, it's kind of the weather's
Not
changed.
anymore. It used to be.
Okay.
But now it's hot. It's rather hot. Just at night, perhaps a little cold.
A little bit cold.
Yeah.
We're going to talk about the woman. For me, Doc, I think women are special because they brought us into this earth and they are due this special treatment. You know what? Tell us about this treatment, but first of all, tell us about the doctor. What should we know about you?
Okay, my name is Sonsire Coward. I'm from Costa Rica. I was born in San Jose, and then I studied medicine in Costa Rica too, at the University of Costa Rica.
UCR is a very popular school here, huh?
Yes, it is.
So those of you are thinking UCR, what does that mean? Think of UCR kind of like similar to like the Harvard in the US, the best school here. That's where she studied at. But you didn't just study yesterday, right?
No.
How long ago was that? Well, we don't want to tell too many time frame. How long ago was that?
That was I graduated 27 years ago.
Experience. That's what you want. Doc, tell us a little bit about what it is that we're going to look at today on the two procedures so we can get into those two areas.
Okay. So I started working in gynecology because my husband is gynecologist, so we work together.
Imagine husband and wife work in the same spot. Can you do that?
Yes. And the thing is that for many years since I became married, I had 4 kids, and also afterwards I worked in the Peace Corps, and currently
the U.S. Peace Corps.
The U.S. Peace Corps, yes,
Okay.
for 8 years. And now I'm just working with my husband here in gynecology, and I love it because I'm a woman. I know what the diseases that we have while we become elderly.
A little bit older, right?
So I just don't like it because to improve their lives,
The quality of life.
the quality of life, and also because I also know what it is to have them. So I love these topics.
Something important about when you're choosing a physician that not just is a physician but is passionate about what they do. That's important when you're choosing a physician. This particular physician, she loves what she does, and having a specialist in an area and what she do. But you know what? Talk about a little bit about. We're going to look at 2 machines today, right?
Yes, we're gonna. I'm working with 2 different technologies. One is laser, that is for gynecology problems like urinary incontinence, also for when prolapse, but mild prolapse, when the organs are becoming too lower down a little bit.
So that's the first machine, right? Okay.
And also it's called when we become menopause. So
menopause, okay.
The vagina and the vulva become a little bit dry. Perhaps they can have pain with the intercourse or recurrent infections, and all this is improved with the laser.
Okay, so that's the laser machine that we're talking. And then there's another machine that some people call the Kegel machine, but it's different names.
Yeah.
What about that machine? That's the machine that they sit and they sit with their all their clothes, right?
Yeah, with all other the laser is without clothes, but the share is with clothing. And the thing is that they both are like they work
They work
very
together.
well together.
Okay.
Because the laser is like more superficial in the tissues to improve the what I told you, like humidity, lubricants, and
For the fun time and
yeah.
and for just living,
and,
right?
Yes, and not having like also like recurring infections or pain or things like that. And also the share, the other technology works mostly with the muscle, because the laser can go so deep into the body to the muscle. So the share will take care of the muscle to strengthen that muscle so that it can work well and hold all the organs that we have in our pelvic.
We're gonna go right now to start with the first machine, and then we're gonna get to the second machine, and then we're back. Doc, where's the machine now?
Here is the laser. So it's called photona laser. And let me show you the functions. Okay. So here we have, let me start it.
So you don't have to be
see.
too technical to get this, right?
No. It's very easy. So I'll show you the gynecological treatments that we have with our laser. What we use is this part. The laser basically is a light. It's light. The thing is that the body will interpret like perhaps it has had like a burn. And the body will come to this specific place to repair. That's the way we have like
regenerate.
The benefit from laser. But it's not a burn. It's just a light that it can feel a little hot, but I cannot say it's painful or nothing.
It's uncomfortable but not painful.
See, and some
Not even
people
comfortable?
not even uncomfortable sometimes.
Oh, okay.
It depends. It's very mild, the treatment. So here we have the different topics that we can treat with the
Doc,
laser.
is this just for women, or do men do this too?
Certain treatments we can do
For men too.
For men, like for example, the one that I told you, like taking care of HPV lesions.
Okay.
That can happen in male and female, and we can just like burn them and eliminate them with the laser. Okay.
But this area here, this is for the women, because this is what's important.
Exactly. So we have here, like for example, a protocol when there is like a urinary incontinence. So when you have like those episodes when you miss like urine, when you do an effort, or you laugh, or you have a cough or something like that, and you have like that involuntary
urine.
missing urine. Yes. So that's what we treat with this. Okay. And also we have another treatment that is when perhaps after childbirth or life, the vagina become a little bit too loose, so we can tighten it. So
Doc, can we get it to like when they were 20?
Yeah.
20.
That's the good part.
That's a good part. All right, 20. Great.
And not just because it become a little bit closer,
Closer?
It close, but also because it functions better. Okay.
Oh, so the medical purposes, but the health side. That's what it's for.
Yes, it like improves the quality of life, because sometimes also couples can have like problems because they don't have like good experience with their intercourse, because it's painful, because it causes infections, because the vagina is very dry, so it's not like something they enjoy. But with these treatments we can do it better for the woman and also for their couples. Everybody.
So
happy.
guys out there, this is the vagina maintenance, right?
Exactly.
Vagina maintenance. So you should really, if your wife is having this is good for her.
Yeah.
And it's good for you too.
Exactly. For both.
for a two-piece. Imagine you only pay once, but you get two people.
That's
Wow.
that's what we say. Most of the time, that the first session is paid by the woman, but the second one
It's paid by the husband.
by the husband, because very happy with
Pretty
the
good.
results.
And you know what? Sign us up.
Treatments, that is when after menopause, like the vagina gets dry, it has not so much elasticity, so it can get like broken the tissue, recurrent infections, it can be itchy. So with this we resolve all those problems too.
Wow.
Okay, and also the ones that is for prolapse. Prolapse is when we have like it could be like the bladder or the uterus is like getting like out, like
The uterus is not in the right position.
not right in the right position, but not when this is beginning. We can treat it with laser.
Okay.
When it's too
Too
big,
advanced?
the problem is surgical. But at the beginning, and to prevent having to have a surgery, we can treat it with laser.
I've had subjects like this, and I recommend a lot of the patients to always prevent rather than pay for it later.
Exactly, and not just because of the payment, because the surgery has other risks, and
Yeah,
And
the,
yeah, so it's
the
better.
risk versus reward, that doesn't make sense to wait.
okay, yes. So it's better prevention. This is preventive.
This is preventive maintenance for the health and quality of life of a woman.
Exactly.
Doc, I love the machine.
Okay.
I think we need to sign them. You back there seeing this, as a man, for me, is that I think a woman's should be taken care of, and this is an area that we should, as men, we should support our wives or your significant others to come do preventative health care in an area that's so important.
Exactly. It's very important to have taken these things taken care of with time, and also is quality of life.
You heard it from the doc, quality of life. We're going to be moving to the next machine right now. Pura vida. Always